Hi, good morning. My name is Ileana, and I'm going to be your nurse today. I'd like to take a few minutes to provide you with some education on bevacizumab, also known by its brand name of Avastin, a chemotherapy drug that you will be taking as part of your cancer treatment plan. Before we get started, do you have any allergies that I should know about? You don't? Perfect. You have been described bevacizumab to treat your cancer. This drug treats a variety of different cancers, including cervical cancer, glioblastoma, hepatocellular cancer, non small cell lung cancer, ovarian cancer, fallopian cancer, and peritoneal cancer. It may also be used to treat metastatic, cervical, colorectal, and hepatocellular cancers, as well as renal cell carcinoma. Today, I'll be focusing on its use in metastatic cervical cancer treatment, taking into account that that is your diagnosis. Bevacizumab is a targeted therapy, which is different from traditional chemotherapy. It works by blocking a protein in your body called VEGF, which is short for vascular endothelial growth factor. VEGF helps tumors grow by creating new blood vessels that feed them. Bevacizumab interferes with this process, essentially shutting off the blood supply to the tumor and ultimately slowing its growth. This medication is given by IV infusion, usually 15 milligrams per kilogram every 3 weeks, depending on your treatment plan. The first infusion may take a little longer, around 90 minutes, so that we can monitor you closely. The second infusion is usually administered over 60 minutes if the first infusion went well. After that, infusions are typically shorter, around 30 minutes. Patients with a complete response following more than 6 cycles of treatment may discontinue chemotherapy and continue maintenance therapy instead. Like any medication, bevacizumab does come with potential side effects. Common ones include fistula formation, which is an abnormal passageway between a hollow organ and a body surface or two hollow organs, GI perforations or bleeding in your digestive system, hypertension or high blood pressure, heart failure, bone death due to the decreased blood supply, kidney problems, hemorrhage or excessive bleeding, blood clots, delayed wound healing, fatigue, and headache. We'll be monitoring you closely for these side effects throughout your treatment. However, it's very important that you tell us about any new or unusual symptoms you experience, even if they may seem minor. One important thing to keep in mind is that bevacizumab can interfere with healing. Therefore, if you have a surgery coming up, it's important that you let your doctor know as soon as possible. We usually need to withhold administration of bevacizumab at least 28 days before and 28 days after any surgery. Our goal is to keep your treatment as safe and effective as possible, and that means good communication. If you have any questions, concerns, or experience any changes at all to how you're feeling, please reach out to your provider. We're here to support you every step of the way. Thank you for taking the time to learn more about bevacizumab.